Hello, my MSc OT student. Today, I gonna teach you on the topics of enhancing occupational therapy services, occupation center practice, and research too. Okay. Before we're gonna go inside into the detail of lecture today, I'm gonna take you to the learning outcome again. Learning outcome, the first, you need to explain the use of occupation center in OT clinics practice. Second, you can synthesize the use of occupation center, occupation based, and occupation focused in occupational therapy clinical service through a case study. Yes, today you're gonna implement occupation based via OTPF4 into the cases. Okay. And the last one, you can analyze the rationale and significance for implementing occupation center practice into OT clinical service. Okay, here we go. This is the message from Professor Dr. Annie Fisher, that she is OT scholar. She came from the Division of Occupational Therapy, Department of Community Medicine and Rehabilitation in Sweden. Okay, her message is about our problem today. Our problem today continue to be with implementing this belief to what we do. As occupational scientists and occupational therapy researcher, educator, and practitioner, that is, we do not always respond to our mandate. We do not always respond to our mandates and use intervention and evaluation method that reflects the central power of occupation to our profession. Okay, this is very strong message. This is why in our Department of Occupational Therapy, Faculty of AMS, Chiang Mai University, we try to promote the power of occupation-based practice. This is very important. Dr. Annie Fisher, she is scholar. She published more than 100 research articles, and she wrote many books, 30 books and book chapter a lot in occupational therapy. Okay, inside about this, before we're gonna go inside, I think the keyword that we try to grab in our mind and in our spirit is occupation. Occupations as the form of intervention will be provided. Like Professor Molinek said, occupation include active, include purposeful, meaningful, contextualized, and impact on health. This is 5 keywords. It's very important for consider what is the occupation. Okay. In the previous time, most of occupational therapy, we use and implement impairment-based practice due to it's very easy to link to medical models, and we can use like this in bodily function, structure, follow from the problem-based. This is the based on the approach we call bottom-up approach. But now many countries that produce occupational therapists to serve the country and in the world. Most of the country like this came and asked for occupation comeback, reclaim occupation as the mean and end. This is why the top-down model use occupation-based, focus on the outcome-based, and focus on the occupational outcome or outcome-based. It's very important. that is occupation-based outcome that we need to set. We set occupation-based goal and occupation outcome is linked together or aligned together. This is very important to move ahead in terms of the implementation and in terms of occupational therapy service. Okay. Occupation's meaning is everyday personal activity that people do as individual, in family, and with community to occupy time and bring meaning and purpose to life. Occupation can involve the execution of multiple activities for completion and can result in various outcomes. This is from OTPF for 2020. That is means of occupation. That occupation can categorize as ADL, IDL, health management. This is very news that we know because in the previous time, health management that is the part of IADL. Now, health management is separate to be area of occupation. Okay, rest and sleep, education, work, play, research, and social participation from OTPF4 as well. Before we're gonna go forward, the paradigm shift already in terms of why we need to move ahead of occupation or occupation-based, occupation center and occupation focus. Occupational therapy is powerful means for enhanced participation in everyday life activity, show direct link to health and well-being. OT process established as the engagement in daily occupation that promote and reinvigorate or strengthen the individual health and function. In the previous time, we adopt the medical models, encourage practitioner establish rationale for practice. As a result, occupational therapists began to focus on specific in bodily function impairment rather than use occupation and holistic approach that we forgot. This is why we came and try to remind everyone as occupational therapists, occupation comebacks, and we need to use occupation as holistic approach to guide our implementation of OT process. This is the contemporary paradigm shift and encourage and reintegration of occupation as the core of therapeutics intervention in providing clinical reasoning in practice. This is paradigm shift. Focus in occupation-based practice lead to more client-centered approach. Okay. Before we're gonna go inside again, that we need to think about, we know frame of reference, we know model of practice, we know about occupational therapy practice frameworks. The frame of reference is the theoretical or concept idea that has been developed outside professional, but with judicious use in applicable with occupational therapy to guide and structure practice. The keyword is adopt outside the professional. What is the frame of reference that we know? Many frame of reference that we need. NDT techniques. Some frame of reference we use behavior. And this is we maybe take from another or outside profession. Okay, the second is model of practice. Model of practice is occupation-focused theoretical construct. Okay, this is built from occupational therapists or proposition that has been developed specifically to explain the process and practice of occupational therapy. And the big umbrella that is we call frameworks, occupational therapy practice framework or OTPF. That's kind of central concept that ground occupational therapy practice and build common understanding, build common understanding of the basic tenets and vision of the profession. OTPF 4, OTPF 1, 2, 3, 4 serve not as does not serve as a taxonomy. It's not the dictionary or taxonomy, theory, or model of occupational therapy, but its design OTPF must be used to guide occupational therapy practice in conjunction with the knowledge and evidence relevant to occupation and occupational therapy within identified area of practice with appropriate client. Okay, the framework is divided or categorized into two terms or two major sections. The first that we call domain, and the second that we know is the process, right? This is the development from the beginnings of the framework edition 1. Beforehand, we call OPP, that in my generation that we learn is occupational performance profile. This is uniform terminology. Yes, this is terminology. Where is process? In the first time that we know, in 1994, after that, OPP guide only domain and terminology. It's very hard to implement. This is why AOTA launched the various version and update from edition 1, edition 2, edition 3, or third edition, and the fourth edition that we use now, 2020. Okay? Insight into domain and process, or OTPF force, or the third edition and fourth edition, that you can pick up and see what insight is occupation-based intervention and occupation-based practice insight about this. And they can explain about intervention. Have a look. Practitioner use information about client gather during evaluation theoretical principle to select and provide occupation-based intervention to assist client to achieve physical, mental, social well-being, blah, blah, blah. About this is occupation-based intervention. Occupation-based is the characteristic of best practice. The characteristic of best practice method used in occupational therapy, in which practitioners use an evaluation process and type of intervention. Use evaluation process and intervention that actively engage the client in occupation. This is occupation-based. Okay, occupation center describe or categorize two terms where occupation is called and includes two occupation. Okay, occupation center on the right hand side and on the left hand side. On the left hand side is focus, we call occupation focus. And on the right hand side, we call occupation-based practice. Occupation focus is information of person, even environment, occupation related to occupational performance or associated with occupational performance, ability, skill, competence, or occupation or occupational performance. Occupation-based practice is doing. That is the hand of work. That is, occupation is the main ingredient. Include assessment, evaluation, and measure the outcome. Occupation-based practice characteristic, the best practice method used in occupational therapy. Okay, practitioner use evaluation, process, and type of intervention that actively engage the client in occupation. Okay, I restate it again. Okay, occupation-based practice. Sometimes we can summarize as occupation as the mean and end. Occupation as the mean is the use of occupation as the treatment to improve the client impairment capacity and ability to enable eventual occupational functioning. Capacity and ability are required to perform tasks, practice and improve when the individual engage in occupation as mean task as activity chosen has systematically done so to act therapeutic change agent. Keyword again, therapeutic change agent. That is the mean, the process in terms of evaluation or assessment and treatment that is trying to use like this for change the client. Okay. Occupation as the end is referred to client functional goal or the outcome in which to be carried out within give environment within their own comprised role. This is done using whatever ability and capacity he or she possess or have using any required adaptation. Occupation can be remedial in the sense that it is considered purposeful, meaningful to client with hypothesized to motivate performance. This is very important. Insight in occupation-based practice state in the key 3 words or 3 key points. The first is assessment includes occupational interview and skill observation in most natural contexts possible. It means we need occupation or authentic occupation or need real occupation need to be takes place. Treatment use occupation in most natural contexts possible and go focus on facilitating engage in occupation and participation in life rather than only reduce impairment in personal body structure and function. It need to focus and facilitate enable client to engage in occupation. They can perform activity that is very relevant to meaningful and purposeful of their need. The keyword is meaningful, relevant, useful to person occupational goal and life flow. This is very important that we need to implement about this when we approach or engage and interview with the client. Prepare intervention that find out about this occupation related to the client. Okay, implementing the mean and the end into OT process. Before we're going to go into the inside of OTPF, that we starting point the OT process in evaluation process, right? Evaluation process in OTPF inside include occupational profile that we know about history of occupation that is come from the client. What is their occupation in the previous time, now as the being, in the previous time is doing, and for the future, what we're going to do of becoming, right? And after that, in evaluation, need analysis of occupational performance. And very important, need to synthesis of evaluation process. This is evaluation process, okay? Followed by intervention. Intervention process includes intervention plan, intervention implementation, and intervention review. Intervention plan need to establish occupation-based goal or occupational goal and supportive goal or support goal. Because this is look like a gear. that the gear up from inside to move small gear. And after that, it escalates to the big occupation move that is from the client. This is we call mean. Evaluation and intervention is located in the mean. Occupation as the mean. Occupational outcome or occupation as the end. The outcome or targeting outcome are the inherent or the productivity. It's in the process and serve as targeting goal to guide therapy process at the end. Okay, this the evidence provide background and support OT process. In Thai, Dr. Surinya used occupation-based practice to message. The first is การปฏิบัติงานทางคลินิกโดยอิงแนวคิดกิจกรรมบำบัด In another word is การปฏิบัติงานทางคลินิกโดยมีกิจกรรมการดำเนินชีวิตเป็นฐานใช้กิจกรรมดำเนินชีวิตเป็นฐาน but to me make is easy is OBP คือการใช้กิจกรรมการดำเนินชีวิตเป็นจุดเริ่มต้นและเป็นจุดสิ้นสุดของการให้บริการทางกิจกรรมบำบัด this is I try to is the same is similarity because this is from the occupation as the mean and end. Okay, insight. Occupation as the mean and end. Occupation as the mean we can summarize, which is when the specific occupation is used as the mean assessment intervention in therapy to bring about change in personal performance. Occupation as the end is the goal or product of intervention or product of intervention outcome. Okay, for example, occupation-based practice in assessment, occupation-based assessment consists of person doing occupation. Presumably, person make a cup of tea or a cup of coffee in their home. Intervention, that assessment we know already is located on occupational profile. They love to drink tea at home. That is the tea. Intervention adapt and change the way the person is doing their occupation from improved performance. We need to provide a cathode, tipple, and memory pump for our client. Outcome, that is the end. Outcome evaluation measure how person is now doing their occupation. Can he or she make a cup of tea when he wants to make a cup of coffee that want to do? If we find out some problem, we need to fix and re-evaluation. What about the basic skill and what is how to put about the function, how to mobilize our client, engage in their meaningful activity. This activity is progress with he or she that we need to understand about inside the system. Okay, in the previous time, AOTA 2014, at that time it's OTPF 3 or the third edition. Occupational therapy, we have a type of intervention. At that time, we got 5 types of occupational therapy intervention. The first, we start from occupation and activity that in the previous time we call OBI. Okay, and we have preparatory method. Preparatory method is and task is represent about presumably we make a sprinting, we prepare to use about wheelchair. We use some activity about skateboard, incline board, double curve, about movement, something like that. This is preparatory method. And after that, we use purposeful activity, right? We got education and training. We have advocacy, education and training, education and training used in terms of skill-based. For training as well, advocacy is related. It's about how to support, how to advocate. Is need to support the client. Some client they face with occupational injustice. They lack of opportunity to study, lack of opportunity to join the occupation. This is why need to advocacy, and group intervention is the last one. Presumably in the previous time like this, I have a look.
Hi everyone, this video just presents strong participant who engage with the program OTMCS. Now he is going to use the skateboard or sliding board on the table. The table have to paint in the background of the figure.
Okay, this is the video footage show about preparatory method. Preparatory method is like prepare or preparation. Preparation for to another step. The client, they need about how to deposit, about what we call strength, power, even though about sensory stimulations, waiting for use about sensory receptor between how to use about the tool. That is preparatory method. And after that, it's turned to be better.
Presents those participants who engage with the wood rings. It's like the floor, but certainly half of the circular and look like donut. Now she engaged with and try to grab these objects and put the object into the car on the table. Now we arrange two colors. First color is blue shades and the left side is the yellow shades. She had to pick and place by bringing from the ground on the table to the floor. Sometimes it's so hard. Now we're still on practice way. Practice the process. Good. Excellent. This video good.
Okay, this is purposeful activity approach. This is got purpose and got direction. Classify and try to differentiate the color of the ring, or about maybe stacking cone, or need to classify something in terms of the purpose. This is purposeful activity, but this is not occupation. But it's look like the stairway in the second step is the look like got put inside more than the complex, or more than got some things in terms of how to use complex more than the preparatory method. Okay, and this is the occupation-based intervention. Have a look.
Oh my God, this is the process how to use fork, have to back into the traditional dishes, and we have to try to use the affected side on the left hand and handle the forks with utensil and pick. And he can keep it into his mouth by himself. It's difficult because
okay, this is occupation-based intervention. That's everything is the first is the real context. That is the real dishes that the client use spoon to scoop this favorite dishes or snack into his mouth. The practice is continued until he got skill, and this is we try to adapt environment, use the holding cup, or makes a handle is bigger for assist him for complete occupation. Okay, for engage in occupation. This is occupation-based intervention. Okay, but now the 2020 OTPF 4, we have 6 type of occupational therapy intervention. The first we call occupation and activity. About the preparatory method and purposeful activity approach is blend together in terms of that we call intervention to support occupation. In the previous time, it's likely to be hard to identify what is the preparatory method and what is the purposeful activity approach. Some therapists have what we call see in this direction. Some another know about this side. Is the AOT likely to know about this situation, but they combine together or integrate together in the same, just only intervention to support occupation. Even though the first stairway or the second stairway move into the third one, that is occupation. Okay, intervention to support occupation is the best. And the type of intervention still got education and training, advocacy, group intervention, and we have a new one because COVID-19 used these interventions of occupational therapy, OTPF, both we call virtual intervention. Okay, occupation and activity. Occupation and activity select and intervention for specific clients are designed to meet therapeutic goals and address the underlying need of client mind, body, spirit to use occupation and activity therapeutic growth. The practitioner consider activity demand and client factor in relation or association with client therapeutic growth and context. Occupation is broad and specific daily life. Events that are personal and meaningful to client. Now we got area of occupation that you know. Activity is component in occupation that are objective and separate from client engaged in the context. Activity as intervention are selected and designed to support the development of performance skill, performance pattern to enhance occupational engagement. This is very important. That is inside of the meaning of occupation and activity. Intervention to support occupation is the method and task that prepare the client for occupational performance are used as a part of treatment. Keyword, as a part of treatment session in preparation for concurrently with occupation and activity or provide client as a home-based engagement to support daily occupational performance. Presumably physical agent modality and mechanical modality, many modality that we use. Autosys, protosis, sprinting, this is the intervention to support occupation. Assistive technology, environmental modification, wheelchair mobility, this is intervention to support occupation. Education and training. Education is represent to the knowledge, but training is facilitate or acquisition of concrete skill for meet specific goal. Okay, it means that education is look like abstract knowledge in your brain or in your understanding, and information about occupation, health, well-being, and participation to enable client to acquire healthful behavior, habit, and routine. Training is facilitation of acquisition. Concrete concept, not abstract, concrete skill for meet or it can align with specific goal in real life, apply situation. In the cases of skill refer to measurable component of function that enable mastery, that we know the mastery is proficient or competent. Training is differentiated from education by its goal of enhanced performance. as opposed enhance understanding. Okay, education enhance understanding, but training enhance performance. Okay, although this is why we mix together. Okay, advocacy. Advocacy is efforts directed toward to promote occupational justice. We try to battle or tackle with occupational injustice and empowering the client to seek the obtain resources to support health and well-being. Let them to occupational participation. Advocacy is likely to use to enhance them, have opportunity, provide resource, provide something for client, have a right, have a welfare, have human right to do as their occupation they need to do. Okay, this is advocacy. Group intervention is the use of distinct knowledge of the dynamics of group and social interaction and leadership technique to facilitate learning and skill acquisition across the lifespan. Groups are used as methods service delivery because we need about why we need the client to do together to perform some activities together. It's not just only about the skill, but also we need social participation. Social skill, very important. Communicate skill need to be taken place inside. Many technique leader or let them to find out their leader to help to enable. This is look like about the group or society. Functional group, activity group, task group, social group, and other group that we use this as intervention. Okay, virtual intervention just sometimes is not the quite new, but in the previous time we know, but it's not separate into about the type of occupational therapy. Now, virtual intervention used as simulated real-time, near-time technological or technology for service delivery. Presumably, or for example, telehealth and telemed, telebox, telecommunication and information technology that in COVID-19 during period, this very long hardship of occupational therapy or whatever professional use this to interact with the client. mHealth mobile telephone application telephone used for give a service, video footage sent via many platforms for the client, for the caregiver to do. It is virtual interaction or virtual intervention. Okay, now here we go. This is very important step that we're gonna implementing OBP into OTPF, OT service. Okay, implement again. This is start from evaluation, intervention, evaluation got occupational profile, analysis of occupational performance, synthesis of evaluation process. This is in under evaluation process. And intervention plan, we got, intervention process need intervention plan, intervention implementation, and intervention review. And forgot, go ahead to occupational outcome or targeting outcome. Okay, this is I took from OTPF and put in one page. One page can explain to everyone about domain and process, about the way of thinking from the first step. I move in here. We know on the left-hand side to the right-hand side from the orange to the blue one. Occupation as the mean and end. And inside Occupation at the mean is evaluation process and intervention process. At the end, is targeting outcome. This is occupation based, and we go inside from step one. Okay, step one. Step one from evaluation process, starting by occupational profile. Need to know why client seek service, blah blah blah, or what is the client occupational history. Example criteria life experience. What are the client value and interest? This is insight about occupational profile. And the second is analysis of occupational performance. We need in here is complete occupational activity analysis to identify demand or occupation and activity on client. Select and using specific assessment to measure quality of the client performance or performance insight. It's very important. And synthesis of evaluation process. This is determine the client value, priority for occupational participation, or develop and refine hypotheses about client occupational performance, strength, and deficits. Okay, this is into about occupation, into about evaluation process. Okay, the next is intervention process. Intervention process start by intervention plan. Have a look in here. This is for OTPF4. Intervention plan is developed plan, which involves select objective, measurable, occupation-based goal, and related time frame. This is why very important. We need to set occupation-based goal or occupational goal with SMART, specifics, measurable, achievement, reality, and time bound. We need to put inside and need to select the method for service delivery, including that what is type of intervention that we're going to provide for the client in this intervention process. It's presumably or not presumably includes, we can select the topics of occupational or occupation and activity, education and training, or this kind of the activity is advocacy, or this kind of intervention is a group intervention or virtual intervention. Select about. Okay, this is intervention implementation. Okay, and the last one of intervention process is intervention review. Intervention review is re-evaluate the plan, how implement or determine the need continuation or discontinuation. What is the referral or its achieved outcome in here or not? Okay, observe, check about satisfy or satisfaction of the client in here. The outcome is different from the intervention review. The outcome is the product or evaluation, the program, evaluation of the occupation-based goal that we set. Select outcome measure by use occupational process evaluation. Is includes about compare progress towards goal achievement with outcome. This is maybe put in terms of the goal and intervention. Okay, congruent with client goal, consistent with targeted outcome, or able to predict future outcome. This is very important. That is the outcome. This is the circle of the occupational therapy process in mapping: evaluation, intervention, and pre-evaluation. Okay, evaluation is need to know occupational profile, analysis of occupational performance, evaluation again in the targeting outcome, work or not. Intervention need to use intervention plan, intervention implementation, re-evaluation, re-analysis of occupational performance, review the targeting outcome, and identify for continue OT or discontinue OT. Okay, this is occupational therapy process mapping. Okay, have a look. This is the case study that I put insight into the OTPF. Okay, the first this we call we use about the pathology condition. The first step, you need to know about the disease or condition of the clients or something happened. Okay, even though why they got problem. Okay, this is we use stroke client occur when supply of blood to brain is either interrupt or reduce. Okay, this happen brain does not get enough or oxygen and nutrient, and brain cells start to die. The stroke or CVD got two most type: ischemic stroke and hemorrhagic stroke. Okay, the ischemic stroke is cause of artery being blocked or narrow. Hemorrhage is caused by blood leak into the brain. Okay, we try to use this. We need to know the first step is pathology, condition, and heal. That we need to know. We know about the symptom of the stroke or not, like confused, including trouble speaking and understanding, headaches, or vision problem, trouble walking, or lack of coordination. About this is medical record that we read in the file in the hospital or in the computer that they send to us. Okay, this is why we need to think about pathology and condition or health. Okay, we need to evaluation in terms of occupational profile. The profile of this stroke client, his name is Mr. Su. He's a male, 53 years old, and the dexterity of hand is located on the right side. He's a boat worker, work in the ship. He look like fisherman and alone, and general appearance, elderly man or senior people, short hair, confused, poor hygiene, and dry skin. Diagnosis is right hemorrhage stroke. Okay, got the chief complaint is right hemisphere right hemiparesis, confused, poor hygiene, and fair dynamic sitting balance. Or we grab about this point: fair dynamic sitting balance, poor hygiene. Think about this is ADL. We need to improve. We need to promote about this related about ADL. Okay, and inside evaluation, we need to ask the client, ask the caregiver inside about identify the following in here. What occupation does the client feel success? What barrier are affected in their success in design occupation? In about here, we need to think about in terms of domain. In the third step, think about the domain. It's related with about what the area of occupation. We need to focus first. What is the priority? If stroke, we need to think about in terms of if they cannot, about ADL or basic ADL need to be come first, like bed mobility, dressing, and personal hygiene and grooming. This is why we need to consider first, because it's necessary, it's a fundamental to keep intervention. Okay, and after that we need to consider about the current factor. What is the current factor of this in the domain about this neuromuscular skeletal? movement-related function. Joint mobility of upper limb, left hand side normal, right side limit, ROM, muscle function of upper extremity, and what else about the right hemisphere, right hemiparesis, right hemiparesis. Movement function, upper extremity, left side normal, right side no hand function. And performance skill, motor skill. Client can perform activity in sitting position, but he cannot perform activity with cross midline. This is very important. He cannot perform activity or use or do activity with cross midline when he move right side and he has likely taking risk for falling. Client cannot use right hand to reach, grab, hold, and release objective or object that affects when he does activity. When he does something about activity, some of activity he can use left hand side to compensate, but does not well as his dominant side. Okay. Performance skill, social interaction skill. Client can start communication with therapist, but he talks so fast and have articulate problem. This is one kind of we need to think about how to move his about ability into social participation. Okay, performance pattern routine. Client need to perform basic ADL by himself due to he live alone. In future, he needs a self-help, context and environment. He has no family. The client need to live life and foster home in the future. In the future, he maybe stay in the foster home. He need to be what we call due to he does not have wife, relative, and in the future is maybe we talk already is maybe go to the shelter or a foster home for the future that he maybe in the elderly people need to take care. Okay, analysis of occupational performance. This is very important in terms of about how to grab activity and how to bring about into analysis. The first is base mobility, and second is dressing, and the third is the personal hygiene. Base mobility, the client can rolling independent, side-lying to sitting is supervision. It's very important. Side-lying to sitting is supervision. It means in the future, he need to mobilize himself on the base. And if he done like this, we need to promote. From observation to evaluation, client use left hand to push up himself from prone to sit, but he move incorrectly and quickly. It can lead to risk postural hypotension and fall. This is the concern. Dressing, wearing or put on shirt in the bed or on the bed. Minimal assistance, take off the shirt on the bed. Supervision, wear the pants on the bed. Supervision, take off the pants on the bed. Supervision, wear or put on and take off the shirt and pant. This is need to be considered how to help him to getting this. This is the basics. Dressing, ADL. He cannot wear shirt and pant by himself because he confused and forgot something. We need to promote and educate him. Difficult to move and his balance is not good. Tightrope is most difficult step. Okay, for client because he used one hand and this hand is not dominant side. It's difficult to control when he used left hand side of the complex movement. This is very important due to getting that not just only the t-shirt or shirt, it still have a pant as well. Then the pattern inside need to be practiced and skillful, rehearsal and training more. Okay, not just educate, but also training need to be implemented. Personal hygiene and grooming is dependent, and this is care by nurse because he stay alone in the ward and does not have a caregiver to help. Environment in this have the problem because it's far from the toilets. Okay, synthesis about this. Synthesis of evaluation process. It needs to be summarized. And what about how to set up about occupation-based goal? And which the type of intervention that you're going to use for this intervention process. Okay, this for example, intervention plan, intervention process in here. Intervention plan need to establish occupational goal or occupation-based goal. Occupation-based goal 1, clients will perform bed mobility, sideline to sitting by himself within 4 weeks. SMART goal, specific, right? Specific is bed mobility is ADL. Is likely to be achievement, is reality. Time bound is, we can see measure from sideline to sitting, right? Time bound is 4 weeks. It makes sense. Supportive goal is client describe, understand how to prevent postural hypotension within 30 minutes. Okay, intervention implementation. Therapist guide or give the knowledge about what is postural hypotension, how to prevent postural hypotension, how to manage when postural hypotension, intervention review, checks, ask, repeat, or ask the client about how to prevent and follow up. Okay, this is the first in the supporting goal 1.1. Supportive goal 1.2. Client can change position from sideline to long sitting within 2 weeks. Therapeutic activity use client bend left knee up, reach left hand cross the body to grab the midrest. Third, pull and loading body to weak side. Fourth, use left hand to push up the body to sitting position. And 5 or 5, adjust position. And after that, intervention review, client can show his or her performance, because his name is Sue. Show about performance, check about the safety, and interview satisfaction. Is still practice and show about his performance is good or not, and still go on to practice and practice. Okay, this is occupation goal 2. Occupational goal 2 is client will get that both shirt and client by get that or get that by himself within 4 weeks. Okay, supporting goal 2.1 is improve dynamic sitting balance from fair to good within 2 weeks. because it's very important. Use about not just only about about statics balance, need about dynamic sitting balance. Therapists adjust client position and posture, chair or side of bed, provide activity to improve dynamic sitting balance in all directions. By gated activity or get up, increase speed when the client can perform add multi-direction to movement at bilateral hand activity. This is the intervention implementation. Intervention review it, reassessment, sitting balance, and check up about the safety and interview the satisfaction. Okay. In here, you can see supportive go to point 2. Client can wear shirt and the supportive go to point 3. Client can take off shirt. Okay. Put on and take off shirt. And the intervention to point 4 is client can put on or wear the pant, and 2.5 client can take off the pant. Okay, and intervention is related with the way to getting that in the shirt and getting that with the pant, both put on and take off, and check with the intervention review. Inside here, you can put the picture or the drawing that you do. But we need about PDPA, about inside, about face as well. Okay, use the technique or some tool put inside about the detail. Okay, interventions. The occupational goal 3. Client is able to use a towel in wrapping his body, on bed by himself within 4 weeks. Supportive goal 1 of 3.1. You can see dynamic sitting balance. This is supportive goal 3.1. Improve dynamic sitting balance from fair to good within 2 weeks. This is duplicate from 2.1. This is okay. It's a better because it's integration. You just only want how to move about this activity can help not just only one occupation or activity in terms of about the rubbing towel and wearing and take off shirt and pant as well. Okay, this is the same. And to the 3.2 is supporting goal. Client can use towel in wrapping his body on the bed within 2 weeks. Therapists provide client to wrap the body on client bed. Therapists advise client to ask nurse and other prepare equipment and set the time for pick up and move about the set equipment to left side and within range of reach out. This is practice. And after that, go to the outcome. Okay, the outcome need to compare progress toward occupational goal and occupational outcome. Okay, the outcome, and here is very important that we can reflect that we done already is success or work or not. This is occupational goal set client is able to perform bed mobility sideline to sitting by himself within 4 weeks. Is success in 4 weeks. Client is able to will get dead by himself within 4 weeks. And success in 4 weeks, but success in 6 weeks because have 2 parts, shirt and pant, put on and take off. It's very complex. And the third is client able to use towel rubbing his body on bed within 4 weeks. Within 4 weeks, but in the situation of implementation 2 weeks. This is the real client in hospital that practice with occupation based like this. Okay, the outcome of the occupational based practice or occupation center practice, this is now we have focused on occupational performance. On here, we still have many of the outcome about the category of the 10 outcome. Okay, occupational performance, improvement, participation, well-being, health wellness, quality of life, prevention, enhancement, role competence, and occupational justice. This is the outcome that we do for each occupation. What occupation need to improve the outcome about this? That is the end of the success is mean to role competence, try to preserve the role as the mother, have the mother for feed milk, or need to use the outcome of the occupational justice. We need to prepare for the client have a right to do activity in boarding area, in bordering area. They cannot study, but open opportunity. We use about advocacy for the client near the neighboring country from the Myanmar and minor ethnic minority war and across the country. We provide small schools, support them for resources. This is occupational justice for them, have a right to study, right? This is advocacy to the outcome is occupational justice, okay? Effectiveness of implementing OBP in research. Okay, I show just only 4 research articles. The first is the effect of occupation-based community rehabilitation for improved activity of daily living and health-related quality of life of people with disability after stroke, living at home, a single subject design. Okay, this is one kind you can grab it, and I put in the Canva or Mango Canvas already. You can download and can read inside. The second that I show you is effects of the occupation-based program for women with intellectual and developmental disability who are incarcerated, who are incarcerated. That inside in here, you need to focus and find out about the conclusion, find out about the method and why it's success in about using occupation-based program for women with intellectual and developmental disability. The third is the effect of correction-based occupational therapy program of Alzheimer's disease, a randomized controlled trial. And the last one that I suggest you, effectiveness of occupation-based intervention on performance quality for hemiplegic stroke in community during randomized clinical trial study that you can use and find the full text in Mango, CMU Mango that I upload already. I think this is my lecture today. I think it's hope to useful, and you're gonna learn with me in this video footage. Not just only one time, you can have several go to and practice hearing me, focus on my animate or PowerPoint and follow with about the instruction. Okay, the last message. This is I keep the last message from Professor Molinex. He is professor and head of occupational therapy from School of Health Science and Social Worker in Griffith University in Australia. That he is one of the OT scholars who promotes occupation-based practice as well. One of our mistakes, that is his word, of profession has made is to try to justify the use of any treatment method, but argue that as long as we are aim for occupational outcome, then this is occupational therapy. Okay. Thank you, Red Indies, for your attention, and things hope you enjoy for learnings and research is to see what everybody else has seen and to think what nobody else had thought. Okay, bye bye.